Hey guys, we're back, and last episode we talked to you guys about depression, and today we're going to talk to you about suicide and diving deeper into suicide and suicide prevention. So, doctor, can you please explain what are the signs to look out for if someone is suicidal?
Yes. There is a common misconception in people that whatever thunders doesn't rain. It's not true about suicide. What we see in clinical practice, almost 80% of people have given some indication that they are going to commit suicide. So there are clear-cut indications which one should take seriously when the relative is suffering or the friend is suffering. For example, most of the patient they think about suicide for most of the time. They discuss with friends, they discuss among relatives, they leave some notes. Sometimes they get detached from the external atmosphere, they give away their valuables, sometimes they make their will, sometimes they call the distant friends, and the calls have the content of sort of goodbye. So this thing should take in account, and yes, the previous suicidal attempt is the most severe indicator that a person can attempt suicide next time.
Now, are there certain types of people that are more prone to these suicidal thoughts and tendencies?
Yes, the suicidal thoughts and tendencies are more common in females, but the completed suicides are seen more commonly in males. Initially, what we used to see the working class people committing more suicide due to pressures, but now we are seeing a lot of teenagers, children who are committing suicide uh, due to demands from the school, demands from the family, and they don't have anyone to vent out their pressure. The people who are staying lonely, who are suffering from long pain, for example, maybe they are on dialysis, or the people who are suffering from the major mental disorder, almost the people who complete suicide, 75% of them are depressed, and the other mental disorders like anxiety disorders, in the feet of panic attack also sometimes people commit. The people who are psychotic, who are hearing the voices, the commanding hallucinations, do this, do that, commit suicide, they also end up in committing suicide.
So, you did say that most people give some sort of indication or sign before they commit suicide. What can a family member or friend do if they start noticing the sign in someone?
First and foremost thing, they should directly confront the patient. They can directly ask whether you are feeling suicidal without beating around the bush. If the person agrees yes, they should ask about the plan. If he has got some plan, that indicates even firmer motive to commit suicide. Secondly, they should ask about the intent. What actually you want to accomplish by committing the suicide? If the patient denies that he doesn't have any ideas, but the indicators are there, for example, what I stated earlier, what they can do, they should keep all sharp and harmful objects away from the patient. The patient should be under supervision of one of the relative or friend. Thirdly, what they can do, supervise medication, supervise food. The person should not be allowed to lock the door from inside, from the bathroom or any room. And if the patient is agreeing, yes, he has got some suicide plan, what they can tell, they should postpone it until these people meet a psychiatrist. Or in some circumstances, when nothing is possible, when the patient doesn't agree to meet a psychiatrist, what they can do, just call up a hotline, suicide prevention hotline. In our country, there is a good functioning helpline called as National Suicide Prevention Helpline. It is functioning 24 by 7.
So that's it for today's episode. If you are thinking of suicide or suspect someone is, please get help immediately by calling a hotline or seeing a psychiatrist. Don't forget to subscribe to our channel, and I'll see you guys later.